The next basis for our best practice change comes from a study in the Journal of the American Geriatric Society. This study specifically compared what patients were self-reporting for supplement use versus what was disclosed during the appointment with their clinician. This study combined qualitative and quantitative aspects and was done over 12 months, and it focused specifically on older adult patients, older than 50, and included lots of subspecialties for the clinician side of the research. So it included primary care, neurology, surgery, lots of other subspecialties. And this makes this piece of evidence a real gem because it allows the general applicability to be increased because of the variety of clinical settings that it was researched in, but also because it has good methodologies for research, so it can be applied to the general adult population, but also specifically an older adult population. Now getting to the actual best practice part. From this study, we found that best practice includes implementing a standard protocol for all clinicians, and that the clinicians would be trained specifically for supplement use assessment. This study revealed that patients have so much to tell, but when they feel that their healthcare provider is not communicating their personal interest in the patient's supplement use, there's no flow of communication from either side. The research also concludes that there's a need for education about the risks of supplement use, specifically this education for the clinicians, because this needs to be done to increase the awareness of the importance of documenting supplement use for patients. Clinicians will be trained with protocol on supplement use assessment and patient history approaches. This best practice approach is one of housekeeping in my mind, almost a more big picture approach, in the sense that it's a recommendation for a systemic and standardized change. The problem here is proven time and time again by studies like this one that we're referencing from the Journal of American Geriatric Society. And it's studies like this where the results show that out of 256 patients, only 56% reported supplement use. That's pretty average. And that was reported on the questionnaire. Now, when we look at what was actually documented in the appointment with their clinician, only 5% of that 56% had their supplements discussed and documented from their appointment. With the combination of the other evidences that we've gathered and presented for this project, we have a platform for best practice, and we can use this to create change. Now, the hard part is creating change takes the creation of a culture of commitment to these standards and these protocols for communication about supplements to our patients. And we can do better. We are better. We as nurses are in this profession because we are dedicated to a higher set of standards, and we're dedicated to creating a therapeutic and meaningful relationship between us and our patients. And we, of all things, want this relationship to be safe for the patient, to promote well-being and just general health for our patients. And I believe that all patients should be able to communicate freely and openly with their clinicians about their chosen alternative treatments and the use of their supplements. And this needs to be improved so that this communication is happening so that our patients are safe. In the end, this is all accomplished, and patients of any type can be given excellent treatment when we are willing to look at ourselves and embrace these small and simple changes that can lead us to big results.